Welcome to The Explainer. Today we're going to talk about a disease that you probably think of as something from the history books, but it's not. It's a full-blown crisis right now. We're talking about tuberculosis. So let's just jump right in, because the reality of TB today is, well, it's shocking. Seriously, the numbers might not be what you expect, especially when you remember this is a disease that's both preventable and curable. The impact is just staggering. Just look at this number, 1.25 million. That's how many people died from tuberculosis just last year. Let that sink in for a second. It's a number so big it's almost impossible to wrap your head around, especially when you realize we've had a cure for this thing for more than 70 years. And to put that into perspective, check this out. We hear a lot about the progress we've made against major diseases, right? Well, since the COVID-19 pandemic, TB has just roared back. It is once again the world's #1 deadliest infectious killer. It causes almost twice as many deaths as HIV/AIDS. But, these massive stats, they can make us forget we're talking about real people. People like this young boy Henry from Sierra Leone. An author, John Green, was told by a nurse that when Henry was sick in the hospital, he was the one cheering everyone else up. They even called him pastor because he was always trying to help people. And that brings us to the absolutely maddening question at the heart of this whole crisis, the one you're looking at right now. If we have a cure, how is it possible that millions of people are still getting sick and dying? To figure that out, we actually need to go back in time. Yeah, to really get why TB is still with us, you have to understand its strange, almost mythic history, back when it wasn't called TB, but had a much more romantic name: consumption. For literally centuries, consumption felt like this unstoppable force of nature. I mean, it took everyone from poets like John Keats to the Bronte sisters, even someone like Eleanor Roosevelt. It really seemed like it could get anyone from any walk of life. It was so common that Charles Dickens called it the one disease that wealth never warded off. Someone else called it the captain of all these men of death. It was just a part of life. And because it was everywhere, this really bizarre thing happened. People started to romanticize it. There was this idea called space physica. Basically, the belief was that as the disease wasted away your body, your spirit or your soul would just flower. It would burn brighter, leading to this explosion of passion and creativity. A beautiful idea, right? Tragic, poetic, and completely wrong. But that whole romantic era, it came to a screeching halt, because science was about to deliver what looked like a miracle. A cure that promised to get rid of this plague forever. And this was it, the magic bullet. In 1944, scientists isolated streptomycin, and with that and the other drugs that came after, humanity finally had a cure. It felt like game over. We won. The TB problem was solved. At least, that's what everyone thought. But here's the thing. The way we started treating TB, it wasn't about partnership. It was about control. In these places called sanatoriums, every single detail of a patient's life was managed for them. When they slept, who they talked to, everything. And this whole approach was built on this deep-seated belief that you just couldn't trust the patient. And that idea, as we're about to see, is a theme that has stuck around in a really tragic way. And this is where we get to the absolute core of the problem. See, the cure was never the full solution, because the bacteria itself, it was never the real enemy. Tuberculosis has always been a disease of inequity. This is the trap. It's a vicious cycle, and it's been spinning for hundreds of years. So it starts with poverty. That leads to things like poor nutrition and crowded living spaces, the perfect breeding ground for TB. Then someone gets sick. The cost of getting better and the fact they can't work, it pushes their family even deeper into poverty. And the whole cycle just starts right over again. And the data we have today just proves it. It's undeniable. 50%, half, of all households dealing with TB face costs so high they're considered catastrophic. Malnutrition, it's the single biggest risk factor for TB on the planet. And the funding to fight it? Year after year, it falls billions of dollars short. Inequality is literally the fuel that keeps this fire burning. And we have to be clear about something. This inequity has been deliberately shaped by racism. It's not because some people are biologically more likely to get TB. No way. It's because systemic racism creates the very conditions, bad housing, poor nutrition, no access to doctors, that allow the disease to spread and put specific communities at a much, much higher risk. And the results of this are just horrific. Look at this. In the 1930s and 40s, in Canada's residential schools, the death rate from TB among Indigenous children was 8%. Not total, per year. It's almost unbelievable. And these weren't accidents. These kids didn't have to die. This was the direct result of deliberate systemic neglect. So when you look at it through that lens, you start to see it. The fight against TB isn't just a public health issue. It's a fight for justice. It's a fight for human rights. And that changes everything. Remember that old sanatorium model where doctors controlled everything because they didn't trust patients? Well, 100 years later, that exact same dynamic is still here. As one TB expert, Dr. Jennifer Fern, put it, she knows of no other part of medicine where treatment is so completely based on not trusting patients. And this all brings us back to Henry, the little boy from Sierra Leone, the pastor. His story really shows you the human price of all this. He had a drug-resistant form of TB. He was treated with these old toxic drugs that can cause permanent deafness. Now here's the thing. A much better, safer drug existed. It's called bedaquiline. But patent monopolies kept the price so incredibly high that his country just couldn't afford it. He was denied the best possible care, not because of medicine, but because of money. So in the end, the reason TB is still with us, it's not a failure of science. We have the tools. We have the cure. It is a failure of will. It's a failure of justice. So ending this plague isn't just about finding new medicines. It's about fighting for a world where your chance of surviving a curable disease doesn't depend on your bank account or your passport. The fight against TB, it really is a fight for justice. And that's something we can all be a part of.